I have a mixture of patients. The majority of patients that I see at the Portland are generally straightforward parents that have no complications or problems. I also see a significant number of patients where the baby may have a complication or problem, and that's where my particular expertise is, in helping to counsel parents where the baby may have something which is unusual or abnormal, and giving them an idea of what the implications of that are. The sort of things, the most common things that we do here, for example, are to screen for Down syndrome. So one of the things that we can do is do an ultrasound examination, look for malformations that may suggest Down syndrome, and if the parents suggest that there is an increased risk in the pregnancy of Downs, then we can do an invasive procedure, and early on that's called chorionic villus sampling, where we put a needle through the mother's abdomen into the placenta and take a small piece of tissue to send to the laboratory. It's a very straightforward procedure, done under local anaesthetic, takes a couple of minutes to do, and we have an excellent laboratory which gives us a result within 2 working days as to whether the baby's got a problem or not. In addition to looking for structural malformations, we also look for other problems. So for example, we can make sure the baby's growing normally, and if the baby isn't growing normally, we may consider delivery at an earlier stage. There are other conditions whereby we may diagnose that the baby is anemic inside the mother's womb, in which case it may need to have a transfusion of blood. And we can give the baby a blood transfusion by, again, putting a needle into a blood vessel inside the baby's tummy and giving the baby some blood. I mean, I think the big advantage at the Portland is that we have excellent equipment and very good staff. There are 2 things that you really need. One is the best equipment available, and we're fortunate here to have the best ultrasound machines and the best equipment. It is a very consultant-based service where people are seen by highly skilled and experienced consultants with huge expertise who can make an earlier diagnosis. If you can have senior people looking after a pregnancy from an early stage, then the intervention and outcome is likely to be significantly better. So the advantage here is that you have experienced senior people from the very beginning who liaise, work together in a multidisciplinary approach to help to provide the best outcome for both mother and baby. Continuity of care is extremely important, and having good quality of continuity of care is important. So we provide a service from conception through to adolescenthood, with experienced people in fetal medicine who can look after the baby before birth, with experienced neonatologists and paediatricians who will take care of the child after birth. And that continuity is extremely important in a multidisciplinary sort of fashion.